हेलो।
Yes, sir.
2 मिनट में कॉल बैक करता हूँ। यू आर लाइव नाउ।
Okay, sir. Am I audible? Okay. I think we are having good number of audience. We can proceed. Okay. So welcome to prediction series of community health nursing. So very important aspect of NORSET, where the recent updates and each and every question are being asked. Okay. Yes. Without wasting time, we will be starting with the first question. So I need some good interactions. Good afternoon, all. Good afternoon, good afternoon. Rajkumar, Rajtura, yes, good morning. Sorry, good afternoon. Jyoti, Juhi, yes. So when we talk about rabies, so you all know about the recent stats of rabies, and the impact is also very high. Okay, regarding the street dog issues, the government has taken the actions. But when we talk about pre-exposure prophylaxis and the post-exposure prophylaxis, so what is the term for pre-exposure prophylaxis here? The pre-exposure is like something people who are vulnerable population, okay, who are at high risk, low risk and high risk. So high risk population are vulnerable people who are prone to get this rabies. Like example, who are caretakers of animals, like domestic animals or zookeepers and veterinarians and the nurses who are working in veterinary hospitals. They are the vulnerable population there, who are having close contact, who are having their life with their animals. Like, right? Yes. For those people, we are having pre-exposure prophylaxis. Don't confuse with post-exposure prophylaxis. Here, post-exposure prophylaxis, we are having two things, that is in regimen and updated Thai regimen. Now we are following the updated Thai regimen. When we talk about pre-exposure prophylaxis, can anyone say what is the answer? Can anyone say what is the answer? DC, 3 doses, high risk individuals. Okay, now I told who are prone, that is post exposure prophylaxis and pre-exposure prophylaxis. Post exposure prophylaxis who are not indicated. See, if we are having any injury to, when the dog bites, when the cat bites, or any animals bites, or any abrasions, we are having categories. Okay, according to that category, we are going to give. So I am talking about post exposure prophylaxis. Okay, let me discuss this first, then we will discuss pre-exposure prophylaxis. Okay, yes. So okay, hold your answers. The answer is D only. You're all right. When we talk about post-exposure prophylaxis, we are having category 1, category 2, and category 3. So most of the students are confused in this only. Whether there is an intact skin. When the word comes intact, intact skin, only saliva licking is there. So then we will consider no bleeding, no abrasions, no laceration, nothing. Category 2 is very easy when there is any nail strike. Okay, any nail strike. nail strikes, and abrasions, minimal wound with minimal bleeding, not more bleeding, then we are going to administer rabies vaccine. Category 3 is something like more severe bleeding along with the laceration and severe wound. Okay, then we are considering this as category 3, advanced wound or injury by the animal. Is it clear? Okay. So for this individuals like category 2 and category 3, I am going to give this vaccination. So who are all not indicated? Not indicated individuals. Yes, come on, tell me. Not indicated people. Yes, I need answer from you all people. Yes. Category not indicated or human bites. When human to human bites, there is no indication for post-exposure prophylaxis and bat exposure as per Indian guidelines. Okay, and any insect bite, this you will be confused. Okay, insect bites are not indicated. I am talking about post-exposure prophylaxis, not indicated. Okay, yes. Yes, in category 1, I will say about the management. First, let us finish the indication and contraindications. And okay, in which category? Let me put a question. In which category rabies immunoglobulin is indicated? In which category? And within which day we have to administer the first dose? And you all know that immunoglobulin is given once at a time. And you are going to say which level of prevention it is and whether it is gives which type of immunity, that also you are going to say. Immunoglobulins, it gives acquired, artificial, passive immunity, and especially for rabies it is indicated with category 3 bite, as well as within 7 days to be given. Okay, this is one important point I want to discuss. Okay, here we are having types of immunoglobulins: equine and human. What about equine? That is, we are naming it as RIG. It is 40 international unit per kg. And human, that is HRIG, that we are giving 20 international unit per kg. Okay, you're all right. Yes. Jayani, Sophia, yes, correct. Yes, category B bite immunodeficiency, yes, we can consider, but it is now recently added. That is a good point. That was next I also discuss. Yes, good, Sophia. Yes. See, cow bite, it is a controversial thing, but now indicated is with cat bite dog bite, and any bat exposure. Okay, that is the indicated thing here. And now, especially in India, bat exposure is now, when the direct bite is there, then we can consider the post-exposure prophylaxis. When we talk about bat bite, then it is indicated. Okay. Sorry, this session is for all India audience, though the communication language is English. Okay. Yes, this is for all the audience, especially we are focusing on South and Western Indian people, students who are focusing on OSET exams. Okay, yes. So now we are going to talk about pre-exposure prophylaxis. Okay. Yes, tell me, what are the days we are considering? Total doses is very important. 3 doses. We are going to give 3 doses. And what is the route that we are going to give? IM or ID? You all know intramuscular and intradermal, or intradermal we are going to give. Okay. And what is the days? 0, day of day 0, 7, 21 or 28. That was the answer. So this is the answer. So simply I can explain and go, but you people should regain all the concepts before going for exam. You should gain all the reinforcement should be good there. Okay, yes. Here, pre-exposure prophylaxis is being given, and we are having re-exposure prophylaxis. Re-exposure. Can anyone say what is about re-exposure prophylaxis? That I will explain. That we are going to discuss ECN regimen and updated Thai regimen. Before that, we will finish this pre-exposure prophylaxis. See, now what we have discussed pre-exposure prophylaxis and post-exposure prophylaxis. Under that, immunoglobulin categories, which is very important and which is indicated, that we have discussed. Now, re-exposure prophylaxis. Can anyone say about re-exposure prophylaxis? Yes. So exposure occurs more than 3 months after the last dose. More than 3 months we can consider. When the exposure occurs greater than 3 months after the last dose, then we are going to give re-exposure prophylaxis. Re-exposure we are going to give. The days are 0 and 3rd day. How many doses, total doses we can consider? That is 2 doses. And what is the route? Intramuscular or intradermal. Okay, no requirement of immunoglobulin here. Okay, yes. So now tell me, now we are going to discuss about ECN and Thai regimen. Okay, yes. ECN regimen. ECN regimen in IM route, that you all know. What are the days we are going to consider? Total visits is 5. Okay, 0, 3, 7, 14 and 28. Then, yes, correct, Sophia, you're right. Then, what is the route IM that we have discussed? And it is full vial dose. What about updated Thai regimen that we are following? What are the days we are going to give? That is 0, 3, 7 and 28. How many visits are there? We are having 4 visits. Dosage is 0.1 ml. That is 2-site injection. Per visit, okay, per visit we are going to give 2 doses. 2 doses per visit. Is it clear? Yes. Initially it was like 24 or 28. Now it is updated to 28 only. Okay. Is it clear? Okay. So I think pre-exposure prophylaxis, what is very important point, that is whom it is indicated, and re-exposure prophylaxis indicated, that is in pre-exposure. Post-exposure prophylaxis, what are the category is very important, and to whom we are going to give the immunoglobulin, that is category 2 bite with low immune response. If there are any immune disorders is there, then we can consider this immunoglobulin category 2, and it is mostly directly indicated to category 3 bite only, and if the and it is should be given within 7 days. Okay, yes. Deltoid region, yes, correct. Deltoid region is correct. Intradermal, mostly we will be giving in deltoid only. Okay, yes. Here it is intradermal. DD you can remember, deltoid ID. Okay, yes. Shall we move on to the next question? At primary health center, immunization clinic, the following vaccines are available at the start of a session. All are stored at 2 to 8 degrees Celsius and intact labels are okay. SEPTA. Which vaccine can be administered safely? Here they are telling about what? Easy question. Vaccine vial monitor. See, this time either in prelims or mains there will be one question related to vaccine vial monitor. Okay, vaccine vial monitor is very important question that you should know. Okay, so let me draw a diagram. Outer circle and the inner circle. Here it is darker. Consider this is the darker side. And again, I'm going to draw one more thing, and it is slightly darker. Again, I'm going to draw one circle, that one box. It is slightly darker. Okay. Now, this is for all the audience to easy recall. Here, when the outer circle is darker and the inner circle is lighter, pure light, pure white, then we can use the vaccine. When the outer circle is darker and the inner circle is slightly changed, minimal change, then we can use the vaccine. Okay, here there will be having a pH type of paper material, and when the especially this vaccine vial monitor is shows the heat damage. Okay, heat damage, it ensures the heat damage. Which is the most heat sensitive vaccine? Heat sensitive vaccine. Can anyone say which is the heat sensitive vaccine? Is so it ensures the heat damage. So when the outer circle is darker and the inner circle matches the color, then we should not use the vaccine. When the inner circle is darker and the outer circle is lighter, then also we should not use. OPV is the heat sensitive, most heat sensitive vaccine. Okay. Okay. Now, here, what is the question here? To start the session, which vaccine can be administered safely? First, we have to understand the concept, what they are going to ask. Okay. BCG reconstituted 4 hours earlier, inner square darker than the outer circle. Inner circle is darker. Okay. Then we should not use. OPV open 26 days earlier, inner square matches the outer circle. When it is also matched, then we should also not use the vaccine. Pentavalent opened 21 days earlier, inner square lighter than the outer circle. Inner square is lighter. So we can consider. MR vaccine reconstituted 5 hours earlier, inner square lighter than the outer circle. Inner square is lighter than the outer circle. So what about MR vaccine? So BCG, we can use up to 6 hours, but the average time when we consider, it is always 4 to 6 hours is the maximum we can use. But when we talk about MR, it should be within 4 hours. Okay, we should not use. So this also, but the in vaccine is quite good, but the reconstituted concept is exceeds. So we should not use the vaccine. So option is, so the answer is C. C is the answer. So now we are going to discuss about open vial policy. Okay. Yes. What is the concept of open vial policy? So open vial policy, when we use the vaccine, that we once the vaccine is open, vaccine vial is open, we can use up to 28 days. That we should follow the conditions like maintenance of temperature and storage. Then how legibly we are going to use the lock system. The first and foremost point is maintaining the cold chain and securing. Okay, securing is very important to maintain the potency. So, which are the vaccines that are indicated? That is, first we'll be discussing OPV, then also IPV also we can consider, and pentavalent up to 28 days. Okay, we can use up to 28 days. All the vaccine which I am listing down can be used up to 28 days. What are the vaccines? Then hepatitis B, diphtheria, pertussis, and tetanus all comes under this, and tetanus toxoid also, which are not applicable. Which are not applicable? PCG, measles, MR vaccine also, measles rubella, Japanese encephalitis reconstituted. These are the vaccine not applicable. So please remember this, and it's very, very important. OPV, IPV, polio is very important. Open vial policy included. Pentavalent vaccine, hepatitis B, TT. These are the most important vaccine that you should know. Okay, which are applicable. And easily when they ask about diphtheria, pertussis, tetanus, and hepatitis B, these vaccines are there, and OPV is there means OPV you should consider. Don't confuse between this. Yes, these are not applicable. MR vaccine not applicable. Okay, is it clear? So the answer is C. So now we are going to see about the third question. Now considering the image given below shows the logo of which of the following national programs? Yes. So Beti Bacho, Beti Paho program, India Newborn Action Plan, Janani Sisu Suraksha Karyakaram, and Family Planning Campaign. So what are the concepts, current initiatives of this National Family Planning Program? So you all know that the inverted triangle is the family. So the family planning campaign is there. Here India has taken lot of initiatives considering the National Family Planning Program. That is the first program launched, National Family Planning Program. National Family Planning Program. Here, it is started in the year of 1952. Government ensures a 360-degree media approach. Okay, to promote the modern contraceptive methods, and reproductive health. Considering that, high focus initiative was given with this mission Parivar Vikas, MPV, implemented in 13 states already to improve the access for contraception and family planning services, and it is given the awareness regarding the family planning programs. An extended approach was given with Antra and Chaya. Non-steroidal thing and injectable hormone, that is of 150 mg we are going to give every 3 months, and once a week oral contraceptive pill, that is Chaya. Okay, then the ASHA workers, you all know that is the frontline workers who provide home delivery of the contraception towards the married couple on birth spacing. Okay, that is ASHA worker, that is frontline workers. And you all know under mission, National Health Mission, this ASHA workers were there. ASHA workers covers every 1,000 population. So now we are going to discuss about this Beti Bacho Beti Bago, a small thing. Okay, Beti Bacho Beti Bago, I will write here. It is started in the year of January 2015, sorry, 2015. And what is the core objective is child sex ratio. To promote the women empowerment, this Beti Bacho and Beti Baho program was launched, ensuring the survival and the protection of the girl child. That is a major thing you should know. Okay, yes. Coming on to the India Newborn Action Plan. India Newborn Action Plan was started in the year of September 2014. Okay, 2014 it was started. And what is the motto? That is neonatal mortality ratio and stillbirth ratio. Okay, less than the single digit, we have to achieve the single digit, that is less than 10 per life, that is 1,000 live births. Coming on to the key pillars of this component, that is care during the labor and childbirth. First initiative was pre-conception and antenatal care. Yes, initially the target set is by 2030 only. Yes, it is correct. Neonatal mortality rate should be less than 10 per 1,000 live birth. Antenatal care, now we are focusing on the care during the labor and childbirth. Immediate newborn care and care of healthy newborn. Focus on growth and development. Now tell me. So this is the logo of Beti Bacho and Beti Baho program. Okay, Beti Bacho. I will write Beti alone. So this is the, this they will not give, only the baby who is sleeping, the child baby who is sleeping, they will give. This is India National Newborn Plan, Action Plan. What is this? It is Janani Sisu Suraksha Karyakram. Okay, launched in the year of 2011, June 2011, to eliminate out-of-pocket expenses for pregnant women. Like government is giving and free and cashless delivery, including C-sections. Okay, what they are giving? Free pickup and drop. First and foremost thing, they will to promote the health institutional deliveries. Nowadays in rural areas, they are promoting the deliveries in the institutional aspect. Okay, health institute. So we are going to give free and cashless delivery, including C-section, which includes C-section. Am I right? Yes. Okay. And after the class ends, it is available in the live section of the YouTube, so that you can check after the class also. You can share with your aspirants who are preparing for the exams. And free drugs. Okay, yes. And free diet during stay, very important point. Free diet during the stay in the hospital, during stay. That is for normal delivery. If it is a normal delivery, 3 up to 3 days the mother will get free diet, or for C-section up to 7 days. Okay, yes. And entitlements for sick infants also, the program covers sick infants up to 1 year from the day of 28, free treatment, drugs, diagnostics, everything, and free transport and exemption of all user changes, and free transport for all people. Yes, you are right. Sophia, we have read everything, I guess. You're answering each and every question, so it is appreciated. I need all the audience to give their valuable points so that when we discuss lot of points, na, so your knowledge will improve and you will feel the confidence. Your confidence will rise. So that only I'm asking. I can easily explain per MCQ. I can spend 2 to 3 minutes only. I can explain all the concepts. I can go, but critical thinking and problem solving is very important while approaching an MCQ. So finding a keyword and just like that I can explain and go. But the concept reviewing is very important here. Okay. Yes. Shall we move on to the next question? Yes. So this is one important highlighted question. To avoid overcrowding. So what is the maximum number of people allowed to live in a house with 2 rooms as per Indian thing? Here we are having crowd counting rules. Counting rules, infants under 12 months, that is of 1 year, are not counted. Infants are not counted. Children between 1 and 10 years. See, 12 months, 1 and 10 years. After 1 year and then considered as half person. Anyone after 10 years are considered as one person. Okay. No idea about this question? Yes, I will clarify you. If it is a one room, so one room, how we are categorizing it is like 50 plus square feet. Okay, under 110 square feet, if we talk about one square feet, this is the 1 square feet considering 110 square feet, 2 people can fit. So considering for 1 people, it is nearly 50 to 60 square feet. Okay, that is one point. One room, 2 room, if they ask about 1 or 2 rooms. So that one room is like 100 plus square feet. One room. A general 10 into 10, we can talk about 10 into 10 room. It is one room we can consider. So when it is one room, how many people can stay? One room, 2 people can be occupied. Okay, maximum number of allowed in house. And when it is a 2 room, it is 3 people. When it is 3 room, 5 people are allowed. When it is 4 room, it is 7 people. When it is 5 or more rooms, 10 people. Every two we should add. Every two we should add when the number of rooms are increased. 1 or 2 rooms are increased. Okay. Yes. One room, 2 people. So after 2 rooms, we should add 2 people per room. Yes, come on now. Tell me the answer. Two rooms. What is the answer? Now it is B. Easy, right? Okay. Is it clear? So first and foremost, the important point about the question is if they ask about the infants, if they put a word, there are one male and one female and one infant is there. If they are a family, nuclear family, can they stay in one room or they require two room? Now tell me. Because infants are counted or not? I have thrown a question. You should answer. Yes, infants are not counted. Yes, that is a very good answer, Sophia. Yes, right. So one in one room, a male and a female and an infant can stay are allowed. Okay, this is the important thing I want to discuss. So considering this, children 1 to 10 years considered as half person. So now they require three room or two room. Yes, correct. So now I think each and every concept is clear. So now they require, if now 1, 2 plus half is there, two and a half people. Can they occupy in two room? So here they require one room. So that is clear. They require two room or three room. Yes, two room. Here they require two rooms. So three people, approximately three people can stay. One male, one female, and one infant. Infants we are not considering. So one room is enough. If two plus half, two and half is there, so two rooms we can consider. Okay, yes. So next question, shall we move on to the next question? Okay. As a public health officer, you are evaluating the implementation of the expanded program on immunization covering 9 diseases. You assess the proportion of infants in the community who are fully immunized under this program. This is an example of, so it is they are mentioned wrongly, it is 12 diseases, right? 11 plus 1, 12 diseases. So don't consider there is a mistake, but focus on the options and answer. The concept what they are asking is different. Okay, they're not asking about how many diseases, but fully immunization, fully immunized individuals. What this is an example of they're asking. Healthcare delivery indicators indicates what? And indicators of quality life. Because when this type of question comes in your exam, most of the aspirants are confused. It is a untold truth. As of my experience, I'm just sharing. Okay, yes. Coming on to the healthcare delivery indicators. What does it measures? Resources available, number of human power, and hospital equipments like doctors, nurses, and hospital beds equipment, that is healthcare delivery indicators. Resources available. Resources we can say. Okay. When we talk about indicators of quality life, what does it indicate? Broad well-being, like outcome, life expectancy rate, okay, and literacy rates, quality like life expectancy. Coming on to the utilization rates, actual use or uptake of a service. So vaccination, providing vaccination and immunization, it is a service, right? Getting vaccinated, we are going to give. Now tell me, under the prevention, vaccination comes under what type of prevention? It is a primordial prevention or primary prevention, under primary prevention, or it is a secondary prevention. Yes. So basic need indicators like our survival essential. These are survival essential. Don't ask what is survival essentials like our food, water, shelter, what we are when we are doing about the daily activities. What are the survival essentials? Food, shelter, water, yes, it is specific protection only. You are right. Yes, wearing helmets also, it is primary prevention under specific protection. Is it clear? Okay. So now the answer is utilization rates. When the service is taken upon and actual use of a service to by the pop of a service by the population to the population, that it indicates the utilization rate. So the answer is C. Yes. Shall we move on to the next question here? Now, choose the most appropriate option regarding the reference Indian adult man. Yes, come on, tell me what will be the answer. So he is aged between 19 to 39 years. He weighs 75 kg. His BMI is 20.75. His height is 1.77 meter, and he is free from disease and physically fit for active work. So what are the options given? That is very important. 1 and 3 are incorrect. 1 and 2 are incorrect. Only 2 is incorrect. Only 3 is incorrect. Yes, come on. So what is the middle Indian adult man? Age is 19 to 39 years old. That is correct. What is the body weight? It is 60. That is 55 to 65 kg. That is the important thing. So what about the height? It is 1.77 meters. That is also very important. That is fine. When we talk about the height, according to the recent, that is ICMR guidelines of 2020, what does it indicate? It is 1.62 meter. So this also we can consider. This is the recent guidelines, but actual parameters coincides with the both. Coming on to the BMI is 20.75. This is also considered as correct. What are the other indicators? Health status is free from the disease and physically fit for active work. What about the other important point? Daily activity routine. So I will explain. Okay, this is a very controversial point. This is totally different, but I will explain. Just we will finish the point and I will explain. Okay, his day is divided into 8 hours. We all know our day is divided into 8 hours. 8 hours of sleep, 8 hours of work, and 8 hours of recreation, other activities. This is the day when, that is 8 plus 8 plus 8. 8 hours of sleep, work, and recreation. But for aspirants is totally different, right? We study the concept for 8 hours. We have to sleep 8 hours, we have to work, and 8 hours we have to spend for recreation. But 16 plus hours aspirants are studying. The nurses who studies this concept are studying 16 plus hours. to achieve their goal. Am I right? Okay, that is for our future we are studying. Yes, is it uh, the mandatory thing? But it is totally different when we apply the concept which we learn. Okay, yes, 8 hours, 8 hours, and 8 hours. Apart from the concepts, we are back to the session. Okay, yes. So now tell me which is incorrect mostly. When we talk about the other point, 1, 3, 4, 5, second points is the most incorrect thing because 75 kg, the BMI is also quite increased. Okay, for 75 kg, so that C is the answer. C is the answer. Okay, yes. Yes, C is the answer. Is it clear? Okay. Now, our Indian ICMR updated guidelines, we are having average Indian adult man components. If we take a citizen of India, these are the checklist that it indicates he is a healthy individual, good and healthy individual. What are the components here? Age. Age is very important. That is above teenage. He should cross teenage. That is adult. 19 to 39 years of old. When we talk about the body weight, actually it is 65 kg. The cutoff is 65 kg, 55 to 65 kg. When we talk about the height, it is 1.62 meter to 1.77 meter, and body mass index BMI is between 20.75 to and 21. We can consider health status, like he should be completely free from the disease and he should stay physically fit for his daily work and daily activity routine that I told. He should be dividing 8 8 and 8: sleep, work, and recreation. Is it clear? Okay, here I have written this. If you want, you can take a small note because these are like reasoning and assertion question. It may consider very easy, but it is a very twisty question. Okay, yes. Shall we move on to the next question? Yes. A new national campaign has been launched with the theme Healthy Women, Empowered Families, which aims to promote screening of women and adolescent girls for non-communicable diseases and reproductive health through Ayushman Arogya Mandis. Which of the following does this describe? Is Mission Shakti or Shashwat Nari Shashwat Parivar Abhiyan or Pradhan Mantri Surakshit Matriva Abhiyan, Pradhan Mantri Madhu Vandana Yojana? Next question. Yes. This time we are considering that this question may be possibly from this anyone can come. Yes. First we will discuss B. First we will discuss what is specific nari. It is indicates healthy woman. And Shatkat Parivar, it indicates empowered families. See, all the programs, all the concepts, starting from board committee till now, the budget which is allotted for the health and women, it is only for promotion of the development. The economically they focus. They consider the economic wellness, and mostly it is focusing on health sector. When we focus on health sector, the GDP increases, the level of Indian, like when we consider with other countries, how we are going to consider we are economically developed, we are well developed. So starting from this to this program, everything is to focus on promotion of health and wellness of the country. Yes, okay. Swashit Nari and Swashit Parivar, these are healthy women, maintaining a healthy woman and empowered families. It is to optimize the use of Ayushman Arogya Mandis, formerly known as Ayushman Bharat Health and Wellness Center. Ayushman Bharat Health and Wellness Center. So it is to primarily focus on screening the woman and the adolescent girls conditions like anemia, focusing on anemia, pregnant women are prone to get this anemia, iron deficiency anemia, and like non-communicable diseases which includes hypertension, diabetes, and breast cancer also, to promote reproductive health awareness. So what about the Mission Shakti? Anyone? Otherwise called as umbrella scheme. Otherwise, we can call it as umbrella scheme, launched under the Ministry of Women and Child Development. Women and Child Development. Yes, to promote safety, security, and empowerment of the woman. Safety, security, and empowerment of the woman. And also, it includes women well-being also. Not the primary medical screening here. This Swachit Nari and Swachit Parivar Abhiyan involves screening mechanism also. Like Ayushman Bharat Health and Wellness Center is there. Okay, under this it is following where it is implemented Ayushman Arogya Mandis. What is the primary goal when we consider about the C option? Sorry, B option. B option. Here, screening is going to take place under the vulnerable population, especially for pregnant women and adolescent girls. Okay, yes. Why is this not clear? I think it is clear for me. It is audible. Okay, kindly check your internet. So where we are? Yes, Mission Shakti. It is otherwise called as umbrella scheme. It is not a screening part, but it also ensures the safety, security, and empowerment of the woman. When we talk about Pradhan Mantri Surakshit Matri Abhiyan, so I have explained who are the subscribers of Rapido. I have explained this clearly. Every ninth of every month, all the doctors like who are willing in primary health centers, they are being screened. Okay, they can conduct the OPD section. Under this, they have to register, and each and every doctor can serve the antenatal care OPDs under the specialist with free of cost. Okay, yes. It does not focus on general screening. Okay, it is like every antenatal mother can have a visit, so that private doctors also will be involved in this scheme. Okay, yes, quality of antenatal care is improved, so that this program was initiated to match the deficiency of the doctors towards the population, especially this antenatal care. Okay, to match that, this program was implemented. Coming on to the last option, Pradhan Mantri Matru Badana Yojana. So Matru Badana Yojana dedicates conditional cash transfer. Okay, it gives the financial initiatives like partially the pregnant woman after their delivery they will be jobless. So considering the daily wage woman, they have to feed their baby as well as they have to take care of the family and also promote the nutritional aspect also, right? To match that during the childbirth and child care, so government has taken the initiative. What about for the first child? First child, the total cash initiatives is 5,000 rupees, and it is given in two installments, especially at Anganwadi centers or through Asha worker. First will be 3,000, they will give first installment, and second installment of 2,000 rupees. That is of second installment. Okay. So which vaccines and given after the birth of the child, and registration should be completed within 24 20. The second is always given after the birth of the child, and the 3,000, the first is 3,000 is given during the registration on pregnancy. So considering, I will explain. So considering a woman is being pregnant and under this program, I want to get the cash initiative. So what I have to do, I'll be registering in the Anganwadi centers. So once it is registered, then the verification part is completed. The first installment is given. Okay, or we can also intimate this to the ASHA workers or AN who is under this particular area. Then the first installment is transferred. This is online transfer, financial initiatives, or they can be given through Anganwadi workers also. Then the 2000, the second installment is given after the childbirth, the registration is completed, and the first cycle of vaccine should be completed along with hepatitis B2. Then the second is given. Okay, yes. For second child, here we can give off, yes, it is to 6,000, correct. It is 6,000 only if it is a girl child. Only this is the girl child. When it is given, the single installment is given after the birth and vaccination. Okay, this is to promote the girl child, celebrate the birth of girl child. The government has given only if girl child. Is it clear? That is called Pradhan Mantri Matru Badana Yojana. Okay, yes. Shall we move on to the next question? Okay. Which of the following are objectives of integrated child development services? Yes, ICDS, definitely there should be questions. Yes, come on. So let me read the options. Reduce malnutrition, morbidity, mortality, and school dropout among children. Provide formal primary education to the children aged 3 to 6 years. Intersectoral coordination among departments involved in child development. Improving the mother's ability to meet the child's nutritional needs through the health education. Reduce infant mortality rate by ensuring institutional deliveries. Please come on. Question not fully visible. I think now I zoomed in. Which of the following are the objectives of the Integrated Child Development Services Scheme? A. First, read the options clearly, then proceed for the answer. So, first of all, the core objectives of ICDS, I will explain. Okay. Reduce malnutrition, morbidity, and mortality, school dropouts. Reduce morbidity. The second is always intersectoral coordination with the department, Ministry of Women and Child Development, okay, Child Department, Health Departments, and other delivery services. They are intersectoral approach. Third point, improving the mother's ability to meet the children's nutritional needs through health education. Sorry, intersectoral approach and improving, that is ICDS targets pregnant and lactating mothers, that you all know. Empower the nutrition and health education, that is very important. Nutrition and health education, the focus. Nutrition and health education. That is also important thing. So you all know about the ICDS preschool education. That is, what are the age group that we have covered? ICDS 0 to 6 years. Okay, that is important point. So now tell me, what are the important points that we have discussed which matches the answer. So first, reduce malnutrition, that is important point, and provides formal primary education age 3 to 6 years. So the dropouts also very important, but the focus is on nutritional needs. Okay, so that 3 to 6 years is not considered. Okay, coming on to the intersectoral coordination among the departments, yes, it is considered. And improving the mother's ability to meet the children's nutritional needs, that is also very important point that also indicated. Okay, is it clear? Yes, it is 0 to 6 years. The because that was 0 to 6 years is a repeated question. I think it is 3 times, not such repeated question. Last time also it was repeated. Is it clear? Okay. Now tell me what is the answer? 1, 3, and 4. 1, 3, and 4. Where it is? So C is the answer. Okay. Yes. Shall we move on to the next question? Okay. Here comes the question of vaccination storage. A newly recruited immunization officer finds that ILR. What is ILR? Ice lined refrigerator. As a temperature at 16 degrees Celsius for 10 hours overnight. The vaccines are placed in a cold box and delivered for outreach today. According to the Indian guidelines, which of the following statements is correct? Vaccines can be used because where in a cold box, only OPV can be used. None of the vaccine should be used. The supervisor must be notified. Vaccines can be used if vaccine vial monitor has not changed. Yes, come on, tell me. So before that, Iceland refrigerator. Here they have not mentioned about the power. Iceland refrigerator maintains up to 2 to 8 degrees Celsius. That we all know that. That we can store up to 2 months. So that is one point. And if the power cutoff is there, for example, if there is a power cutoff, it can store up to 5 days. No power. 5 days it can maintain the temperature. But if the temperature thermometer shows more than 8 degree, then we should not use the vaccine because already the vaccine potential is lost. So we should not use the vaccine. Vaccine should not be none of the vaccine should be used, and the supervisor must be notified. So C is the answer. Is it clear? Cold chain. This is called cold chain failure. Is it clear? So OPV can be used or not? OPV is the most heat sensitive vaccine, so we should not use the vaccine. Okay, yes. Is it clear? Okay. So now, next question. Which of the following represents the frequency of continuous variable? So what is the term here, continuous variable? So continuous variable in the sense which give the frequency of distribution. Frequency distribution will be like continuous, like age, weight, height, and blood pressure. Like it will be continuous. Age can be 10, 11, 12, 13. It's a continuous variable. Weight also like 51, 52, 53. Continuous variable. Height 121 centimeter, 171 centimeter. Like it is a continuous variable. So histogram is the one of the important thing which describes a continuous variables. Okay, like 10 to 20, you can say 20 to 30, everything. The data is grouped into continuous class intervals. This is called intervals. Now I think we have entered into the dry and boring concept. Till now we have discussed. So these are some research based questions they can ask. Okay. So like this. Okay, whether it is joined or not. So 10 to 20, this much population are there. So this is how it went. So line diagram. So what is a line diagram here? So like time series data, number of malaria cases recorded each month over a year. So like malaria cases. in each month. In single without showing in single variable, like it shows the frequency distribution of a single variable. So coming on to the simple bar chart. What about the simple bar chart? It is a qualitative approach. It is a qualitative data. So it gives like examples blood groups O, A, B, and AB positive like that, or gender. Only two will be there, either 3, 4 to 5 options, or either gender male, female, or transgender. That is simple bar chart. How many people are there? It is not a continuous process. Okay, component bar chart. What is this component bar chart? Anyone? What is this component bar chart? So I will give you some 3 seconds. You can just answer. So let me give you the definition. It is also known as stacked bar chart. So just listen, I will give an example so that it will be easily you will understand. This is used for categorize data. When you want to show the total frequency as well as the sub proportions within the total population. For example, I can say you are being in a ward. So you are being posted in a ward, right? So considering an ortho ward. In then ortho ward, there is one ward and how my total number of patients is like 30 in a ward, that is ortho ward. So total population, that is total patients in the ward is 30. In that I am going to categorize how many male patients and how many female patients. Only two. So that is called component bar chart. How many male, for example, male patients are like 15, female patients are like 15 equally. So this is called component bar chart. Okay, if they put a word, for example, a question, which of the following represents frequency of continuous variable is different. So continue, all this are not continuous variable, only 2 or 3 options will be there, but in histogram represents the continuous variable and with the series of 10 to 20, and it will be having a continuous series, interval series will be there. When we talk about the component bar chart and simple bar chart line diagram, here only 2 or 3 components will be there, and I am going to categorize the data, compiling all the data. Okay, in that is very important, that is component bar chart. This is very important and expected question. How they will give, yeah, there is an variables frequency distribution is mentioned, and you are being posted in a ward, ortho ward, and there is a group of 50 patients and total female patients are there and total male patients are there. Considering which diagram, which chart chooses best. So like that they will ask. Okay, like simple bar chart, I have mentioned qualitative data. A, B, that is, these are the category, these are the genders, and I am going to do. Not a count. Quantitative is like counting. Qualitative is not like counting. How many A groups are there? These are the groups, and it is direct approach. Okay, the bars have simple charts. Okay, yes. Distinct separation will be there, not a continuous process. So now the answer is A. Is it clear? Okay. Coming on to the next question. A middle-aged sedentary male was diagnosed with essential hypertension. While the case history of the patient, a final year nursing student was asked the rule of Hers pertaining to hypertension. What does it mean? Yes, anyone? What is rule of Hers? You can just come on. What is rule of Hers? DBB, CCC. So 50% of the hypertensive patients of general population are aware of the condition. 50% of hypertensive patients of general population are treated for the condition. 50% of hypertensive patients of general population are adequately treated for the condition. 50% of hypertensive patients of general population are aware of complication of the hypertension. So when we talk about 100% population that the patients are having hypertension, only 50%, that is of rule of health. Only 50% of the people will be having controlled BP. Only in that 50%, okay, controlled BP, and they are considered as hypertensive patients. But in that 50%, let me consider this is the hypertensive population. And in that only 50% are diagnosed. This is the 100% population of hypertension who are diagnosed and undiagnosed, the mixed population. In that 50% are diagnosed. In that 50%, from this only 50% are getting the treatment. Again, in this 50% of the treatment, only 50% are having controlled BP. This is the concept. Is it clear? See, total of 100% of the hypertension population, only 50% are diagnosed, are undiagnosed. Okay. That diagnosed hypertension, only 50% are getting treated. They are getting proper treatment and they are taking the medicines. In that 50%, from the patients who are getting treated for hypertension, they are having only 50% are having controlled BP. This is called rule of Alps. Okay. Yes. So the answer is, any guesses? So what is the answer? Voice is breaking in between. Now it is clear. C, yes. What is the question? A middle-aged sedentary male was diagnosed essential hypertension. Okay, while presenting the case history of the patient, finally asked about the rule of Alps pertaining to hypertension. What does it mean? So 50% of the hypertensive patients of general population adequately treated for the condition. No. Here, total population they are being asked. Only total population who are being diagnosed, from the diagnosed population, only 50% are getting treatment. Here, only 50% of the people knows that I am having hypertension among the total population because it is diagnosed. Remaining 50% are undiagnosed, that they are not knowing that I am having hypertension. Okay, so the answer is A. So again, I will explain in easy terms. Okay, let me see what is the distractors. So this is according to the rule. First option, B option. Okay, 50% are aware of population. Aware population is treated. That means only 25% of the people are being treated. Not 50%, it is 25% only being treated. So what about the C option here? Okay, I will explain. With the percentage, I will explain. 50% being treated in adequately controlled. That means 12.5 percentage. In the 25 percentage, I'm going to get treated, 12.5 being treated in that population. Okay, under control. And 50 percentage of the population, and this does not being connected with rule of Hall's. Complications here, that is not a matter. Okay, I will explain. Here, this is 100 percentage of hypertension population. In that, 50 percentage are being diagnosed. In that 50 percentage diagnosed, 25 percentage are being treated. In that 25 percentage, 12.5 percentage are having controlled BP. So this is the exact thing of rule of man. Now it is clear. Now you guys are identified, understood the concept. In that 50 percentage, okay, undiagnosed, remaining are undiagnosed, but they are having hypertension. Okay, that is different. Now it is clear, I guess. 100 percentage, 50% are diagnosed, and 25 percentage are being treated, and in the 25 percentage, only half of the people are being having controlled BP. Is it clear now? Now it is clear. Yes. So that's what I told. Just listen. After that, I will summarize so that it will be easy to understand. Okay. Yes. Because there are distractors we are having. So the distractors also you should understand. Now the concept is understood, but the people, the students are answering B and C because you are confused. Why they are confused? 50% of the hypertensive patient are general population. Of general, the key word is given. General population is like total mix of hypertensive group and non-hypertensive group, or the general population are adequately treated for the condition. No, from the 50% we are not getting treated according to the rule of health. From the 50% who are diagnosed, in that 50% only we are getting treated. Okay, yes. So the answer is A. 50% of hypertensive patient of general population are aware of having the condition. Yes, that is the true factor. Complications, there is no relation between rule of health and complications here. Only the diagnosis, till treatment, and the control of BP. Okay, yes. Next question. Which of the following statement is not true regarding the incubation period? Very important because keyword is not true. Quarantine is usually advised for a period equal to the maximum incubation period of the disease. Diseases like measles are not communicable during the incubation period. Immunization of exposed patient during incubation period is useful in preventing clinical illness. And in cases, point source epidemic, all the cases occur within one incubation period of the disease. Not true, they are asking. In case of point source epidemic, all the cases occur within one incubation period of the disease. C is the answer. So now tell me, what is the communicable of measles? Before the onset of rash of 5 days, and after the onset of rash 5 days, 5 to 7 days. So how we can say measles are not communicable during the incubation period? During the incubation period is the level of transmission is high there in measles. So not true regarding incubation period. It is true. It is not true actually. It is communicable. So the answer is B. What about A? So what is the keyword of rashes in measles? Oblique spots. Yes, correct, Sophia. During incubation period, communicable diseases are highly spreadable. Yes, you are right. So what about the A option? True statement, because in quarantine is usually advised for a period equal to maximum incubation period of the disease. For example, COVID-19. We are having some 14 days, right? For that, we have given some 1 week of quarantine we are given, and for the incubation period to stop the transmission of the disease. Okay, maximum known incubation period. Diseases to confidently ensure that they are not having any developed symptom. Any developed symptom of the disease should not be arrived, so that the quarantine is given. Okay, to break the chain of infection. What about C option? Immunization of the exposed patient during incubation period is useful in preventing clinical illness. It is entirely based on post-exposure prophylaxis. Okay, post-exposure prophylaxis, like first question what we have discussed, rabies, and even in measles vaccine also, if given within 72 hours of exposure, I am exposed to a particular disease and I am getting vaccinated. That is post-exposure vaccination. Okay, that is option C. That is not. That is also a true option. Not true option. Not. It is a true option. It is a true statement. What about the D option? In case of point source epidemic, all the cases occur within one incubation period of a disease. It indicates point source. Can anyone say what is the point source? Yes, food poisoning in a party. Like we can say, botulinum is there and Bacillus cereus is there. Bacillus cereus is highly found in fried rice. Considering in a party or in a marriage hall, eating a particular food, and from the particular pathogen, all the cluster of population is being affected through food poisoning. That is point source, identifying the point source. In cases of point source epidemic, a cluster is affected, right? All the cases occur within one incubation period of the disease. Within 1 to 3 days or within 24 hours, the peak onset will be there and the symptoms being are achieved. Okay, symptoms are arrived. You can the patient will experience with starting of symptoms will be there. Okay, yes, correct. Shall we move on to the next question? Which of the following measures are followed under National Vector-Borne Disease Control Program to eliminate Kala Azar? Yes, come on. Mosquito net, RK39 rapid diagnostic kit, mass immunization spraying, pyrethroid and insecticide treated mosquito net. So Kala Azar here, this Kala Azar, that is visceral leishmaniasis. Okay. Visceral leishmaniasis focuses on early diagnosis and vector control. That is, what is the causative agent there? What is the causative agent? Here it is sandfly. Not set question. Okay, yes. Now mosquito net is there and rapid diagnostic kits are there. Mass immunization and spraying method. There is no mass immunization for Kala Azar. Only we are having rapid diagnostic kit and spraying. This pyrethroid is being done. Okay. You all know the sandfly will not fly more than 6 feet. So that indoor spraying residuals are being implemented, especially this synthetic pyrethroids are having the potential to kill the sandfly. So that spraying pyrethroid, that is indoor residual spraying that we can use. So the option is 2 and 4. So the option is C. Okay, there is no mosquito nets and insecticide treated things are there and no mass immunization. So the answer is 2 and 4. Is it clear? Okay. Shall we move on to the next question? 18-year-old patient presents with contaminated wound on his right leg following a road traffic accident. He has received complete tetanus immunization and the last dose was 2 years ago. Which of the following should be done in the management of this patient? Yes, come on, tell me. One dose of tetanus toxoid plus tetanus immunoglobulin, one dose of TT and nothing required. Repeat full dose of TT. So here, first I want to explain about wound classification. When we talk about the wound classification, here we are having clean wound and unclean wound. What about this unclean wound? That is tetanus prone wound. That is what we are naming it as unclean wound. If the wound is less than 6 hours, exposed within 6 hours, less than 6 hours. Clean wound is less than 6 hours. Okay, which is clean, non-penetrating, negligible tissue damage. What about non-clean wound, unclean wound, more than 6 hours? Contaminated like dirt, soil, saliva, any puncture wound or any burns. This we are considering as unclean wound. Okay. So now we are going to discuss about the management. So now what is the question? On his right leg following road traffic accident with the contaminated wound they have given. So the wound is unclean. First point is over. The wound is unclean, that is tetanus prone wound. He has received complete tetanus immunization last for 2 years ago on which of the following. Now we are going to discuss about the management table. Now we are going to discuss about the management immunization category. If the tetanus vaccine is given last dose 5 years ago, so only wound care. If it is a clean wound and we are having unclean wound, nothing, no treatment required. No, sorry, treatment is different. No vaccination is required for tetanus. Only wound care is fine. That is same for unclean wound also because before last 5 years the vaccine is given. So no, nothing can be done. So second point, if the last dose is between 5 to 10 years, one dose of TT to be given, and that is the same management for TT for unclean wound also one dose. When here comes the point, the last dose given more than 10 years, it is going beyond 10 years. Then that is for if it's a clean wound, then TT of 1. Then if it is an unclean wound, what we have to give? TT 1 dose plus tetanus immunoglobulin. Okay. Then what about the fourth point? Unknown. Whether the patient doesn't know about the immunization status of the tetanus more than 10 years or not. So if it is unknown, the complete TT course to be given, that is for clean wound. If it is an unclean wound, what we can do? Complete TT dose plus tetanus immunoglobulin. Considering tetanus dose 250 international unit of immunoglobulins to be given, that is of IM route. Okay, yes. Tetanus that you all know 0.5 ml that we are going to give, that is immunoglobulin. If they talk about immunoglobulins, tetanus immunoglobulins, TIG, then it is 250 international units. It is clear? So now what is the answer? 2 years ago, it is between 2 years, between 5 years. Okay, now what we are going to do? Now tell me. So after this, I will summarize the concept of tetanus post-exposure prophylaxis. First, aspirants, you should identify whether it is pre-exposure or post-exposure. That knowledge you should have. Then the components, whether so nowadays what they are focusing is like simple concept, but the options are being complicated. You are due to confusion, people are not answering and coming. They are marking negatives in prelims. What was this question? Whether incubation to be done, whether antibiotic administer, whether we have to stabilize the fever. So that was the priority which is being done. And this fever is there first stabilization of the fever. For septic appointment, there is dehydration also. First we have to give fluids or not. So as per the priority, we should answer. Okay, yes. And another one on triage, like if the patient is unresponsive, first we should give the patient, and CPR is the first management. Okay, unresponsive on the like, sudden they unconscious, first stabilize the patient, that would first and you should give. Other like bronchospasm is there or any other question. Okay, yes. So due to the network issue, sorry. Okay, yes. So what is the answer here? We should not do anything. Don't do anything. So C is the answer. Okay, yes. Now it is clear. So the answer is C because it is less than 5 years. So for clean wound and unclean wound, because it is an unclean wound, you should not give tetanus because it is less than 5 years. So we should not do anything, nothing. Yes, it is clear now. I think network issue from my side. Sorry for the inconvenience. Okay, shall we move on to the next question? So C is the answer. We should not repeat the full course of TT there. 15th question. As a community health nursing officer, you conduct a session on viral diseases that are more likely to affect the ice farms in your area. You focus on a disease which follows a bird arthropod human transmission route where man is an incidental dead end host. Identify the disease. Ebola virus, Nipah virus, Japanese encephalitis, and Zika virus. So what is the fact about this Japanese encephalitis? Here, rice farmers. Rice farmers is Culex mosquito, especially this Culex mosquito, which famously breed in large pools of stagnant water, most probably rice farms. Culex mosquito, what it will do, it will breed mostly in the rice farms. What about this bird arthropod? Bird arthropod human transmission. So natural cycle of this Japanese encephalitis virus is between the birds like herons and ergets hang around the water and the Culex mosquito. So when this infected birds or this infected mosquitoes bite the human gets sick. But the virus do not multiply in the human bloodstream. Okay, and it can to infect other mosquito. There is a transmission of chain stop with the humans. But intermediate host will be like pigs mostly, because amplifying host we can say pigs will be considered as amplifying host, because where the multiplication of virus will be more and the transmission is also high, but there is no symptoms exhibited in the pigs. Only in humans we are considering as a dead end host and the symptoms arises. Okay, pig is the amplifier host. Yes, it is correct. You are correct, Sophia. Yes. Okay, now tell me what is the answer. So you all know about Japanese encephalitis, so it is correct. What about Ebola virus? It is transmitted to direct contact, infected animal body fluids. It is transmitted human to human contact. So now tell me what about the Nipah virus? It is not a vector borne. It is a natural reservoir of fruit bat. Okay, bat. What about Zika virus? It is transmitted by Aedes mosquito and human mosquito cycle. Human mosquito human cycle. Is it clear? Next question. An elderly man living in a drought area has been consuming a lifetime daily intake of 3 to 6 mg per liter of fluoride in the drinking water through bore wells. The type of fluorosis associated with this case is coming on to the concept, that is we are having crippling fluorosis. Again, see. Okay. So 3 to 6 mg per liter. Gripping fluorosis is like extreme end stage of fluorosis, where it exits more than 10 mg per liter. That is gripping. More than 10 mg per liter. So what about dental fluorosis? Dental fluorosis is more than 1.5 mg per liter. What about skeletal fluorosis? It is between 3 to 6 mg per liter. I will explain the symptoms later. First, we will analyze what are the concepts. Okay, Genu valgum. We all know it is also known as knock knees. Nutritional deficiencies are being associated. It is not associated with fluorosis. Okay, yes. Calcium and vitamin C deficiencies. Okay, yes. Coming on to the crippling fluorosis, dental fluorosis, and skeletal fluorosis. This crippling is the end stage of skeletal fluorosis, where the patient will be experiencing the symptoms Like in skeletal fluorosis, the patient will be characterized with osteosclerosis, stiff joints, then spinal immobility will be there. Coming on to the crippling fluorosis. Crippling fluorosis is the complicated, that is the end stage of the skeletal fluorosis. Then the patient will be having poker back. What is the term for this poker back? That is rigidity of the spine will be there. Rigid spine. What about the dental fluorosis? The patient childhood permanent teeth development, there will be problem. In elder men, what will be there? New development of dental fluorosis may complicate to dental fluorosis if it is not noted. Okay, yes. So the answer is not dental fluorosis, because if it is a childhood, then we can consider according to the daily intake of level of fluoride in the drinking water in the bore wells is considered. If it is between 3 to 6, then it is skeletal fluorosis. When it is less than 1.5 or more than 1.5, they have given between 1.5 and 3, then it is dental fluorosis. If it is more than 10, then it is crippling fluorosis. So now tell me, what is the answer? So the answer is D, skeletal fluorosis. Hope it is clear for you all. Oh, it's D. Yes, correct. Okay, never ever answer the question if you are having doubts. Just leave the question and come. Don't take risk. In mains, you can take somehow risk, 10-15 questions, but in prelims, don't take any risk. Try to attend more questions if you are confident. Okay, if your question answering is 70 plus, sir, I am sure that 60 to 70 questions I am correct. Then 10 questions you can take risk. Okay, yes. Shall we move on to the next question? Here comes the confusing and research question. A study was conducted on effectiveness of keto diet for weight loss. Weight of the participants are measured before starting the keto diet and after 1 month of keto diet. Which of the following is most appropriate test to test the statistical significance of the change in weight? Paired t-test, unpaired t-test, ANOVA and chi-square test. Yes, come on. Now tell me, what is the data and the relationship? Where is the data? What is the relationship? In this data, weight will be the data. Weight of the participants are measured before the keto diet and after the keto diet, and it is a continuous process and it is a quantitative variable, whether because it is measured in kgs. So now I am going to this means are the continuous weights and the numbers are being compared with the help of averages. So this shows down the t-test that we are naming it as t-test or ANOVA. Instant eliminates the chi-square test because it eliminates the components. Okay. What is the relationship here? The weights are measured in the exactly with same participants because, and it is going to measure before and after. So I'm going to measure the weight before and after the keto diet. I'm going to compare two sets of data from the same individuals, and the group are paired. And the groups are paired. So it is paired t-test. So the answer is paired t-test. Here there is one group because I will get the answer from the question. A study was conducted on the effectiveness of keto diet. Okay, for weight loss. The weight of the participants are measured before starting the keto diet. Before starting the keto diet, I'm just measuring the weight. And after 1 month, this is the meantime, what is the intervention we are giving? That is keto diet. And the keto diet After that, I am going to measure the weight and I am going to compare whether whether the keto diet helps for weight loss or not. That is the component here. Single group comparison. The comparing the data and I am going to compare with the intervention. Only one group, not two groups. What about unpaired test? Unpaired t-test. Anyone? So here only one group was there. If it is an unpaired t-test, there will be two groups. One group will be getting the keto diet. Both pre and post I am going to take the weight. And second group is there on standard diet and I am going to take the weight. Whether keto diet reduces the weight or normal diet reduces the weight. And I am going to do that. This unpaired t-test also has another name, that is independent t-test. Sorry. Parametric measurements. Yes, correct. Now tell me, what is ANOVA then? Significant, that is analysis of variance I am going to do. Here I am going to compare three or more group, comparing the mean of weight loss between A, B and C. Another one intervention I am going to say, for example, keto diet is there. Here I can give vegan diet, and another one group I can give some other diet, Mediterranean diet or salt restricted diet, any other diet. And we have to compare the result, that is with ANOVA. Okay, ANOVA, two or more groups with intervention, with significant separate interventions, not same intervention for same all the groups. Okay, yes. Chi-square test. Here, chi-square, it will give for qualitative data. Finding the association between the proportions. It is not a continuous means. Not continuous. Anyone can say it is not continuous. Whether can be applied in this group of checking weight for the group or giving diet and assessing that. Non-parametric measurements. Yes, here how many people lost the weight? For example, this keto diet, how many people lost the weight versus how many people have gained the weight? Here I am going to give one intervention for a particular group, like video assisted teaching I am going to give for a particular school children. Then what I am going to do, I am going to check whether weight loss is there or weight gain is there or not. For sorry, the example is on dental hygiene. For example, video assisted teaching for school children, I am going to give an awareness whether the knowledge is improved or not. How many students have gradually increased the knowledge regarding a particular intervention which I given, and versus who have not at all gained the knowledge. So like the same way for keto diet also, I am going to give diet for a group. In that group, how many people gain the weight and how many people does not gain the weight. So I'm going to compare between age specific also, both male and female I am going to compare. Okay, yes, this is with chi-square test. So this always will be confused only if you definitely know the answer. You can answer, or else leave the question and come. Okay, I hope I have explained it as much as possible. Shall we move to the next question? Already we are running out of time. Okay, yes. A researcher studies risk factors for sudden cardiac death in young athletes by examining 150 athletes who have died suddenly and 300 who are not. Reviewing their medical records to identify possible contributing factors, all of the following statements are true about this type of study design except. First, identify the type of study design. What is study design here? Here it is, case control study design. In this case control study design, how many athletes were dead? 150 dead. So that are cases. So 300 are alive. That is 300 alive in the sense they are controls. So what I am going to do, I am going to identify the factors, looking back the medical records to find the exposure. I am going to find the exposure so that, sorry. So what is the thing that to identify the incidence and risk ratio can be measured? Yes. So the C is the answer. Before that, reviewing the medical records so that I can find the exposure details. So it is incidence and risk ratio can be measured here. Except, they are asking except how? It is efficient for studying rare outcomes. Yes. Case to control ratio 4:1 increases statistical power. How? Only 150 athlete exist, okay, out of 300. You can increase the statistical power. How? So how in the sense like the mathematical benefits, max is out of power, out at 4 controls, 4 controls per one case, that is 4:1. Okay, to identify the exposure and the outcome. So this is the 4:1 statistical power. It gradually increases. Okay, you set a limit of number of cases. Okay, yes. Coming on to the recall bias is a potential limitation. In case control studies, like we'll be going retrospective. We are having prospective and retrospective. In retrospective, we are going back and I'm going to analyze the risk factor there and analyze what is the exact reason. In prospective, concurrent data. Today a patient comes, today I'm going to review and today I'm going to do everything. That is prospective. Okay, recalling the past exposure, which is highly susceptible to recall biases, such as cases as much as more we are going back and raise the brains and remember potential exposure than healthy controls. So this is the recall bias on potential limitation. Okay, here. So that is fine. Here, what was the question? All of the following statements are true about this type of study design except they have given case control study design, which cannot be done. Why C is not the answer? Anyone say? Why C will not be a part of case control study? C option. Incidence and risk can be measured. Here, we are going back. We are going back and getting the risk exposure. Here, we cannot able to identify whether the true risk or relative risk factor. The risk ratio finding is very difficult in case control study. You can only calculate odds ratio to estimate the association. Okay, if you are going back 150 or death, I'm going to extract the risk factors to the case sheet medical records. We cannot say it is a true risk. Only relative risk, true risk or relative risk. Only odds ratio can be measured. Okay, risk ratio is the major problem in identifying the incidence and risk ratio in this population, in this case scenario. Is it clear now? Okay. The case to control ratio can be increased with the statistical power 4:1 and recall bias is a potential limitation. Yes, it is always a problem there. Shall we move on to the next question? This research needs critical thinking. Always put last. If you are having enough time, you can answer this type of questions. Okay. Which of the following correctly matches the level of monitoring under National Iodine Deficiency Disorder Control Program with the indicator assessed? Primary level urinary iodine excretion. Secondary level iodine content of salt. Tertiary level neonatal TSH screening. Quaternary level serum T3 T4 levels. Correctly matches the level of monitoring. Here we are having primary level, secondary level, tertiary level, and any other levels are there? Only three. In primary level, like the fortification of iodine, and we are going to assess whether the program is functioning good or not, like process monitoring. In process monitoring, iodine content in the salt. How I am going to identify that? Any idea? Like whether if it is working or not. Like the first and foremost is iodine fortification in salt. Like any retail shops, households, how they are using. So process monitoring is very important. That is iodine in salt. Secondary level of screening, I'm going to do exposure control, exposure monitoring. Whether it is exposed or not. Like urinary iodine. No. Urinary iodine excretion. Like finding the median. Middle-aged school children, I'm going to collect the urinary sample. Like 90% of the dietary iodine is excreted in urine. Assessing the median, we can able to identify the gold standard biological indicator to confirm that this gold standard is always urinary iodine excretion. What about tertiary level? It is called impact monitoring. That is neonatal TSH screening. This is the final level biological outcome. Biological outcome. Is it clear? So now tell me what is the answer, which is correct. Primary level is not urinary iodine excretion. Secondary level iodine content of salt. No. Secondary level only will be doing that is called what? Exposure monitoring. Tertiary level is impact monitoring. That is correct. Quaternary level serum T3 T4 level. This is not at all a component of National Iodine Deficiency Disorder Control Program. So the answer is tertiary level. I think this is a new learning for you all. Yes, this was expecting this time. I'm expecting this question will be there according to the expert's opinion. Okay, yes. Shall we move on to the next question? Which of the following is not the indicator used in global hunger index? Undernourishment, children below poverty line, underweight children, child mortality. Not an indicator, global hunger index. In global hunger index, in global hunger index, inadequate food supply will be there. Then undernourishment. Coming on to the children undernutrition, wasting and shunting. That is according to the weight, sorry, according to the height, the weight should be maintained. According to the age, height to be maintained. If it is not meant, then it is shunting. Okay. Coming on to the third point, under 5 modality. Under 5 mortality. Undernourishment, children below poverty line, underweight children, child mortality. So undernourishment also there, and children below poverty line, it is not a direct impact of global hunger index. Okay, not economic status will provide a line. Therefore, the poverty line is the economical indicator, not for multidimensional poverty index. Okay, things used for multidimensional poverty index, but not for global hunger index. So poverty line will not be there. Underweight children, yes, obviously, and child mortality also will be there. So children below poverty line will not be the indicator for global hunger index. Undernourishment will be the indicator. Children, underweight children, and child mortality. Okay, is it clear? Okay, in simple terms, I will say global hunger index. It is a tool it is designed to measure and track the global, that is regional and national levels, nutritional status, nutritional outcomes according to the programs, not the economical status. Okay, is it clear? So this poverty line indicates for poverty index, not for global nutritional impact will not be measured. So that children below poverty line will not being impacted towards the global hunger index. Is it clear? Apart from that, other components like inadequate food supply, undernutrition, and the children with malnutrition, for example, this wasting and shunting, and under 5 mortality also comes under this global hunger index. Shall we move on to the next question? Okay. So two studies were conducted. Study A had population as the unit of study. Study B had healthy individuals as the unit of study. Study A and B are ecological and community trial respectively, or ecological and field trial, case control, randomized control trial, case cross-sectional and field trial. First, you have to identify population as a unit of study. When we talk about population as a unit of study, we can say as correlational study, that is ecological study. The researcher does not look at individual people, instead they look at aggregate data for entire population or groups. Entire population or groups. Just wait, don't answer because this is a tricky question. Okay, this is a tricky question. Classical example I can give: per capita sugar consumption of 10 different countries we can take, and we are going to assess the average diabetes of prevalence in those countries, not the incidence. I'm going to assess the prevalence. You don't know the sugar intake of any specific individual, only the population average. So that is the classical example, and I am going to study A had population unit of study and study B healthy individuals as the unit of study. So now healthy individual B. So now here they are field trials because experimental epidemiology is there. Like vaccination drives, polio is to be given, it can be prevented before getting sick. So I'm going to give the vaccinations here. Here, entire unit we are taking as a unit as a population. So it is an ecological study. where correlation I'm going to do. So it is an ecological. And I'm going to do B. What is B? Healthy individuals. See, in A, not every individual what they are doing, what they are consuming, what the quantity you want, you don't know. Only I'm taking the average that per capita consumption of sugar of the particular countries is this much. So I am going to assess the prevalence of diabetes in those countries. Here I cannot know, I do not know how many individual is getting 10 grams of sugar or 20 grams of sugar, I don't know. But when we talk about study B, add healthy individuals as unit of study. How we can say healthy individuals? Because the vaccination can be given and we are having the checklist. So I'm going to consider this. So that can be achieved only through field trial. Here, ecological and community trial. Because community trial is entire group, not an individual. So it will not be there. Here, case control. In case control, no data is being evaluated retrospectively, so it will not be there. Randomized control trial. In randomized control trial, sampling selection is totally different. Okay, I am having a guidelines, each and every individual getting an equal chance. Okay, that is RCT here. I'm going to do intervention for both the groups, so it is not an related with this study. When we talk about cross sectional and field trial, it is correlation study, not a cross sectional thing. So, sir, how it is not cross sectional? Because the unit is for cross sectional study, the unit will not be population, the unit will be individual. The unit will be individual here. It measures the exposure and the outcome to find the prevalence. It does not fit to this answer. And we want to assess the individual, how many of them are exposed to COVID-19 and outcome. How many are being diseased? How many are being having the disease? So that is totally different concept here. So we are taking entire population. So ecological is entire population, correlational, and here also correlation is there. But it is not a community trial, it is a field trial. So the answer is B. Here, cross-sectional will be like individual. It is a entire population. Is it clear? Okay. To rest audience, I will just summarize this concept. Okay. Here, two studies were conducted. Study A is at population as a unit of study. Unit of study is population. Study B add healthy individuals as unit of study. Study, they are asking what is study A and what is study B. Here, study A is choosing a entire population as a unit. So population as a unit. When we are comparing, okay, study B is individual. So before that, you should know which type of study, which type of trials will be having individuals as the population, group as the population. Okay, entire group as the population. In ecological, already I told, ecological is correlational study, whether it is having positive correlation or negative correlation. I will give an example. Two groups are there. I'm going to give intervention post-test or pre-test, that is totally different. Okay, I'm going to give an intervention. I'm going to assess the individual data. Okay, and I'm going to assess the entire group of data, whether giving an intervention to a particular group will increase the component or decrease the component. So that is one point. So that is correlational study, that is ecological study for entire population. When we talk about community trial is I'm going to give vaccination to the particular community people. I'm going to give health education to the particular community people. So that is different. So that is not coincides with this individuals. When we talk about ecological, if you are giving an intervention, each and every individual is being treated or being benefited towards the intervention, then we can say that is field trial. Each and every population, for example, I'm going to give polio vaccine on a particular community. Each and every children are being identified and vaccination is given. Okay, that is ecological and field trial because healthy individuals are there. not diseased individual or being affected with any disease or illness. That is not a matter here. Now case control. In case control, and I am going to do, I'm going to assess the incidence. Then retrospectively, I'm going to assess the risk factor there. Okay, only odds ratio risk are being assessed, not the concurrent risk factor. True risk cannot be identified. So case control will not take a population here. And randomized control trial. Here RCT will be already the population is defined and each and every individual are being given equal chances. Okay, individuals are already sick there, not healthy individuals. If a particular group is affected and I'm going to divide the group and only the intervention changes. I will give an example. Fever is there for me and I'm going to choose a group of people who are having fever alone, and I'm going to do given intervention. Group A 50-50 I'm going to divide. In that 50, first 50 I'm going to give what? Paracetamol. That is of 650 mg. And another group I'm going to give paracetamol 500 mg. And I'm going to assess which component the fever is being reduced. So RCT, so patients are being given method of, that is lottery method. Each and every individual are being getting equal chances. Okay, this is randomized control trial. Cross-sectional and field trial. So unit is individual. First cross-sectional study, the unit is not a population, it is an intervention because exposure and outcome are being identified. Okay, this group of people having exposure towards smoking, in future they will be having lung cancer. So that is cross-sectional here. And field trial is correct. But two components should be same because study A is ecological, study B is field trial. If you're having enough time, then you can answer this type of question, because though this is a very simple question, actually the last question is very simple, but you should understand, if you know the concept you can easily answer. Yes, any doubts? I think we are end of the session, we are being at the end of the session. Thank you all of the individual aspirants who attended my lecture. Hopefully I gave lot of points whichever are very important. Apart from this, what are the concepts you can learn? That is occupational lung diseases, followed by vaccinations and level of preventions, each and other important components which you felt, that is in previous notes which are asked, like committees and health programs, health days. These are the important thing that you should must read concepts of community health nursing. Apart from that, you can analyze the NOSET patterns, previous NOSET patterns, and read the MCQs which are previously asked and related concepts, so that it will be very helpful. Okay, don't forget to read about communicable diseases and their incubation period. Definitely there will be one question, and also the symptoms, classical signs. Okay, yes, and I wish you very all the best for the exam. All the best. Thank you all.